Hello. Please hit like button and subscribe my channel. Also press bell icon for future video notifications. Thanks.
Blood stem cell transplantation is a radical but highly effective therapy for multiple sclerosis. A study led by the University of Zurich has now examined in detail the way in which the treatment curbs the autoimmune disease and how the immune system regenerates afterwards. A better understanding of these mechanisms should help the treatment approach, currently approved in only a few countries, to gain wider acceptance. Every day, one person in Switzerland is diagnosed with multiple sclerosis. MS is an autoimmune disease in which the body's own immune system attacks the myelin sheath of the nerve cells in the brain and spinal cord. The disease leads to paralysis, pain and permanent fatigue, among other symptoms. Fortunately, there have been great advances in therapies in recent decades. A study by the Department of Neuroimmunology and MS Research at the University of Zurich, UZH, and the Department of Medical Oncology and Hematology Clinic at the University Hospital Zurich, USZ, has now pinpointed why the most effective currently available therapy, a stem cell transplant, works. Wiping out unwanted immune cells, 80% of patients remain disease-free long-term or even forever following an autologous hematopoietic stem cell transplant, says recently retired Professor Roland Martin, study-led and last author. The treatment is particularly suitable for younger people with aggressive forms of the disease. 4 years ago, thanks to the high effectiveness of the treatment and the now low mortality rate, Martin's department together with the USZ clinic were granted approval to administer the therapy. It is the only clinic in Switzerland approved for this treatment. During the treatment, several chemotherapies completely destroy the patient's immune system, including the subset of T cells which mistakenly attack their own nervous system. The patients then receive a transplant of their own blood stem cells, which were harvested before the chemotherapy. The body uses these cells to build a completely new immune system without any autoreactive cells. In the recently published study, Martin's team systematically investigated these questions for the first time by analyzing the immune cells of 27 Siemens patients who received stem cell therapy in Zurich. The analysis was done before, during and up to 2 years after treatment. This allowed the researchers to track how quickly the different types of immune cells regenerated successful reset of immune system. Surprisingly, the cells known as memory T cells, which are responsible for ensuring the body remembers pathogens and can react quickly in case of a new infection, REAP. Further analysis showed that these cells had not reformed, but had survived the chemotherapy. These remnants of the original immune system nevertheless pose no risk for a return of MS. They are pre-damaged due to the chemotherapy and therefore no longer able to trigger an autoimmune reaction, explains Martin. In the months and years following the transplant, the body gradually recreates the different types of immune cells. The thymus gland plays an important role in this process. This is where the T cells go to school, so to speak, and learn to distinguish foreign structures, such as viruses, from the body's own. Adults have very little functioning tissue left in the thymus, says Martin. But after a transplant, the organ appears to resume its function and ensures the creation of a completely new repertoire of T cells which evidently do not trigger MS or cause it to return. Further studies needed for wider approval. These findings have enabled the researchers to understand why STEM. I am therefore very pleased that we have succeeded in obtaining approval for the treatment from the Federal Office of Public Health and that health insurers are covering the costs, Martin says. Muller, Urs Schanz, Elias Jelcic, Roland Martin. Dynamics of T-cell repertoire renewal following autologous hematopoietic stem cell transplantation in multiple sclerosis. Retrieved November 10, 2022 from ift.tt/eduyumq University of Zurich. Immune system reboot in MS patients. Science Daily. ift.tt/eduyumq, accessed November 10, 2022. Thanks for watching. Please subscribe my channel for more videos.